What's up, ladies and gentlemen? Welcome back, Neurosketch with Dr. Kenny. And today we're diving deep into one of the most complex networks in human anatomy, the brachial plexus. Five nerves enter, 100 fibers mix and mingle. A lot of chaos happens in between, and the outcome, the precise nerves that control and command all the activities of the upper limb. I know how intimidating it might sound, but that's what I'm here for. So let's crack it open. So the word brachial plexus comes from two words: the brachium, which means arm, and plexus, which means network. So the brachial plexus is nothing but the complex connection of nerves that supply the arm, the upper limb. So it begins from the neck. It begins from the neck, passes below the clavicle, and extends to the axilla. It supplies almost the entire. It gives almost the entire nerve supply to the upper limb. So the brachial plexus can be divided into five groups. So we have the roots, we have the trunks, we have the divisions, cords, and branches. Roots, trunks, divisions, cords, and branches. And I got a mnemonic for you. I got a tool for you to remind yourself how are these groups arranged. So we have this real Tanzanian drink called beer. So real R for roots, T for trunks, D for divisions, C for cords, and B for branches. So we're going to talk each one in turn, starting with the roots. So the roots of the brachial plexus, they are formed by the ventral rami of the spinal nerve C5, C6, C7, C8, and T1. In short, the roots of the brachial plexus they are formed by the ventral rami of the spinal nerve C5 to T1. But I want you to bold the word the ventral rami. The ventral rami. What is the ventral rami? Really? So let's now look on the organization of the spinal nerve, and to be sure of what is this ventral ramus that we're talking about. So this is the spinal nerve, and the spinal nerve is made up of two roots. So this is the spinal nerve. It's made up of two roots. So these are the roots of the spinal nerves. So one is posterior, one is anterior. So the anterior one is ventral and one is posterior or dorsal. So this is the dorsal root. This is the dorsal root, and this is the ventral root. One among the easiest way to identify the dorsal root is that the dorsal root, they've got the dorsal root ganglion. So the ganglion is collection of neuronal cell bodies outside the central nervous system, outside the spinal cord. So the dorsal root ganglion should always be there on the dorsal root of the spinal cord. So the spinal cord has got two roots, the ventral root and the dorsal root. The dorsal root has got the dorsal root ganglion. So this is the dorsal root ganglion. So this is the dorsal root, this is the dorsal root ganglion. This is the dorsal root ganglion. So this one should be the dorsal root of this spinal nerve. So this is the dorsal root ganglion. Should be the dorsal root of this spinal nerve. So every root is made up of hundreds, a lot of root roots. So we have the root roots that will combine to form the roots, and then the roots will combine to form the spinal cord. So generally, the dorsal root of the spinal cord of the spinal nerve, carries the sensory information, and the ventral root carries the motor information. So this is to say that the spinal nerve is a mixed nerve. So it's a mixed nerve in the sense that it has got both the sensory fibers in it, as well as the motor fibers. So it is mixed nerve because it has got the sensory fibers and the motor fibers packed in one nerve. All right, so forget about this the sympathetic contribution. We talk about this sometimes later, but the spinal nerve, after it has been formed, it is divided into two branches. So these branches, we call them like ramus. So singular is ramus, and then plural is rami. So we have one on the ventral side, one on the dorsal side. So this is the dorsal, this is the ventral ramus, and this is the dorsal ramus. I'm sure now you understand what a ramus is now. Okay, so from this picture, so this is the spinal nerves, this is the spinal nerve. Forget about this, sympathetic contribution. This is spinal nerve. It is divided into the ventral ramus and the posterior and the dorsal ramus. Ventral ramus and the dorsal ramus. So you should always remember to say the word ventral ramus when you are saying the roots. You are talking about the roots of the brachial plexus. So remind me again, what are the roots of the brachial plexus? These are the ventral rami of the spinal nerve C5 to T1. You can never forget about. So let's move now into trunk. So real Tanzanians, drink cold beer. So trunks. So we have 3 trunks. How many trunks do we have? Okay, we have 5 roots, as you can see, 5 roots. So we have 3 trunks of the brachial plexus. How many? 3 trunks. Okay, so we have the superior trunk, also called the upper trunk, upper because it's above, and then we have the middle trunk and the inferior trunk, and the inferior trunk is also known as the lower trunk. So 3 trunks in total. So how are these trunks formed? So the superior trunk, as you can see, is formed by the union between the ventral rami remember now, the ventral rami of the spinal nerve C5 and the ventral rami of the I'm using the word ramus because ramus is singular. So it is formed by the ventral ramus of the spinal nerve C5 and the ventral ramus of the spinal nerve C6. Are we together? And then what about the middle trunk of the brachial plexus? The middle trunk of the brachial plexus, it is like a direct continuation of the ventral ramus of the spinal nerve C7. Okay? The inferior trunk is formed by the ventral rami of the spinal nerve C7, C8, and T1. So that is it on the trunks. Those are the trunks of the brachial plexus. How many in total? 3 trunks. Now I'll take out divisions. So each trunk is divided into 2 parts, into 2 divisions. Each trunk of the brachial plexus is divided into 2 divisions. So we have the superior trunk will divide itself into anterior division and posterior division. So superior trunk will divide into anterior and posterior division. The middle trunk will divide itself into anterior and posterior division, and the inferior trunk, same applies. It will divide itself into anterior. No, this is anterior division. This is posterior division of the inferior trunk of the brachial plexus. All right, then we move into the codes. So remember, real Tanzanians drink cold beer. So we are in C now. We are in codes, and then we have 3 codes. How many codes in total, guys? We have 3 codes. We have the lateral code, medial code, and the posterior code. So why are they called lateral, medial, and posterior? Remember, because everything they have to be relative to something. So the codes of the brachial plexus, they are named so depending on their relationship, or depending with their relationship with the axillary artery. So this is the axillary artery. So anything that is lateral to the axillary artery will be the lateral code. Anything that is medial to the axillary artery will be the medial code. Anything behind the axillary artery will be the posterior code. This is why you cannot see the posterior code from this view. Why? Because it's posterior to it's behind the axillary artery, so it's not seen from this point. All right, so These, they are named so because of their relationship with the axillary artery. You can never forget. So I will ask you in your exam, why is this known as the lateral cord? Why is this known as the posterior cord? All right. So how is the lateral cord formed? The lateral cord, it is formed by the union between the anterior division of the superior trunk and the anterior division of the middle trunk. So the anterior division of the middle trunk and the anterior division of the superior trunk will combine to form the lateral cord. And then on the medial cord, how is it formed? So the medial cord is continuation. It is a continuation of the anterior division of the inferior trunk of the brachial plexus. Okay, so the posterior cord is actually easy. It's actually easy of all those. Okay, why? Because it is a continuation. It is like formed by the union of the three posterior divisions. So we had like anterior and the posterior division, anterior and the posterior division. All the posterior divisions, all the three posterior division will combine to form the posterior cord, and that should be easy. That should be easy to you. So that is it. That's how the cords are formed. And then now let's talk about the branches. Now let's talk about the branches of the brachial plexus. So we have like terminal branches. These are the terminal branches, and I want you to bold the word terminal. These are the terminal branches, but we have some other branches, as we can see as we are descending along the brachial plexus. Okay, guys, we have something here which is like, you see this M, so we have a letter M here, and as you can see, this is a letter M. So the vertex of the letter M, this middle part, the vertex of the letter M is very special, and you cannot forget this nerve is known as the median nerve. So the median nerve is this. I mean, you assume this is the letter M, and so the vertex, like this middle part of the letter M, it forms the median nerve. So whenever you're in exam, for example, you're in a practical, and then you want to identify different branches, different codes of the brachial plexus, most of people, they're starting from the median nerve. Like identifying the median nerve, and then from median nerve you can you can name other nerves that are associated. All right, so this is the median nerve. So the median nerve is formed it is formed by the a division from lateral cord. So we have a lateral branch, a lateral root of the median nerve, which is coming from the lateral cord, and then we have the medial root of the median nerve, which is coming from the medial cord of the brachial plexus. Correct? Yeah, so this is the median nerve. This is the median nerve has got the lateral root from the lateral cord, and the medial root from the medial cord. So this is to say the lateral cord has got two terminal branches, and same as other cords of the brachial plexus, they've got two terminal branches. The very first terminal branch is the lateral root of the lateral root of the median nerve, as well as the musculocutaneous nerve. So this is the musculocutaneous nerve, and this is the lateral root of the median nerve. So to complete like letter M, you see we've already seen, like, we'll have the musculocutaneous nerve, we have the lateral lateral root of the median nerve, and then we'll have the medial root of the median nerve, which is coming from the medial cord. And so to complete the letter M, we have this nerve here, which is known as the ulnar nerve. Okay, so we've already seen three nerves that are coming from medial and lateral cords. And then see, guys, we are supposed to have, like, we have seen each cord should give two terminal branches. So we were supposed to have like 6 nerves by now. I mean 4 nerves by now, but we only have 6. We only have 3 nerves, because you see this and this, they combine to form one nerve, and you should never forget about that one. All right, so from the posterior cord we have 2 nerves as well. So we have this one is known as the radial nerve, and then this is the axillary nerve. So as I have said, guys, these are the terminal branches, and I ask you to bold the word terminal. These are the terminal branches, but we'll have some other branches as well. So we'll have some other branches. So we're going to discuss each one in turn. Okay. So so this is a dorsal lemma. So I want you to bear in mind that we are not talking about the dorsal lemmas, because the dorsal lemma, they are not forming the brachial plexus. What we are talking about today is the ventral lemma of the spinal nerves. All right, so we have these nerves here, like branches here. So this branch here, these branches, they are going to supply the longus coeli as well as carinae muscles. We are not going to talk about these muscles, so I mean it's nothing really to bear in mind. But we'll have special nerves like this one is coming from the superior, from the C5 root, which is the dorsoscapular nerve. So the dorsoscapular nerve, remember we just discussed the muscles of the back, so it supplies the rhomboid major, rhomboid minor muscle, as well the levator scapulae muscle. But we also have a nerve here which is very, very important. It is known as the phrenic nerve. So the phrenic nerve has actually got 3 roots, 3 roots contribution. We'll have C3, C4 and C5, but because the brachial plexus is starting from C5, this is why you say you have a contribution from the brachial plexus. The contribution from the brachial plexus to the phrenic nerve. The phrenic nerve is very, very important because this nerve supplies the diaphragm, and so when you have a damage to a phrenic nerve, you can have this life-threatening respiratory complications. Why? Because it is a mass of respiration. So whenever you have damage to the phrenic nerve, which is rooted from C3, C4 and C5, you can have serious life-threatening respiratory complications. Alright, so we have another nerve over here. You see it's having roots from C5, C6, C7. This nerve we call it the long thoracic nerve. It is not a long thoracic nerve because it's actually long. So this nerve is about 22 to 24 centimeters. So it's a long nerve, but it is not the longest nerve in the human body. But it is long because it travels quite a distance. Okay, so these are the branches that are coming from the roots. These are the branches that are coming from the roots. The long thoracic nerve, I haven't told you, the long thoracic nerve supplies serratus anterior muscle, the serratus anterior muscle. So damage to the long thoracic nerve, as we've seen the pectoral region, discussion of the pectoral region, it will result into winged scapula or the winging of the scapula. We have discussed it somewhere else. Alright, so now let's move to the trunks. So from trunks we only have 2 branches, and the first branch is the suprascapular nerve. The suprascapular nerve is coming from C5, C6 because it's from the upper trunk, and so the suprascapular nerve, we have seen it when we discussing the muscles of the shoulder. It supplies 2 muscles, the supraspinatus muscle and the infraspinatus muscle, infraspinatus and the supraspinatus muscle. But you see, we have from the same trunk, the superior trunk also have a nerve to subclavius. So this one goes to innervate to supply the subclavius muscle, So divisions are actually very unique here, because divisions that do not contribute to any branch. Wow! So it does not, the divisions of the brachial plexus do not give any branch, but cords a lot. So the cords have a lot of branches. So the division they just divide, but they don't deliver. They have no branches. But cords, as I said, a lot of branches. Okay. So from the lateral cord, we see we have the lateral pectoral. This is the lateral pectoral nerve. Lateral pectoral. Because of lateral pectoral nerve, it means you have a medial pectoral nerve. A medial pectoral nerve. Guys, remember, I'm telling you, the lateral pectoral, it is known as the lateral pectoral nerve just because it comes from the lateral cord. So it is coming from the lateral cord, and this is known as the medial pectoral nerve because it is coming from the medial cord. And what so these muscles, the lateral pectoral nerve, it supplies mainly supplies pectoralis major muscle, but it also gives some fibers through this connection with the medial pectoral nerve that's going to supply the pectoralis minor as well. So the medial pectoral nerves, it supplies both pectoralis major and the pectoralis minor, but the lateral pectoral nerves, it mainly supplies the pectoralis major muscle, but it also gives some fibers through the connection with the medial pectoral nerve to go to supply the pectoralis minor muscle. Guys, these nerves, once they go into the pectoral region, the lateral pectoral nerve goes to the medial side, and the medial pectoral nerves go to the lateral side. So they are confusing when you're taking when you're dissecting the pectoral region. So you have to be sure, be sure that the names are actually depending on the codes that they're coming from and not the places they are going, because you're going to see the medial pectoral region, medial pectoral nerve is lateral to the lateral pectoral nerve, or the lateral pectoral nerve is medial to the medial pectoral nerve, and it's going to confuse you 100 times, 1,000 times even. Okay, all right. So from the medial cord as well, from the medial cord, we'll have the medial cutaneous nerve of the arm, or the medial brachial cutaneous nerve. So the medial cutaneous nerve of the arm, it supplies the cutaneous skin of the arm, medial cutaneous nerve of the arm. Okay, but also we have the medial cutaneous nerve of the forearm. So it is the medial antebrachial cutaneous nerve. Okay, that is the medial cutaneous nerve of the forearm. So it supplies the forearm. So let's now talk about the posterior cord. So what are the branches that are coming from the posterior cord? So the posterior cord has got 3 branches, and they are easy. All of them, they are known as the subscapular nerve. So they are subscapular nerves. But we have one is above, one in the middle, and one is below. So we have this upper subscapular nerve, the upper subscapular nerve. But the upper subscapular nerve, as we've seen, it supplies the subscapularis muscle. Of course, even the lower subscapular nerve, so this is the lower subscapular nerve, it also supplies the subscapularis. Both lower subscapular and upper subscapular nerves, they supply the subscapularis muscle. But in addition to subscapularis muscle, lower subscapular nerve also supplies the teres major muscle. The teres major muscle, you can find the discussion of the muscles of the shoulder region. I mentioned something like this. Okay guys, remember we have some loops. This in the brackets, these are the loops value of these nerves, and you're going to be asked in your exams to name some. For some of the nerves, you're going to be asked to name what are the root values of this nerve of the brachial plexus. For example, the lower subscapular nerve and all that. All right, so we have a nerve in between the upper subscapular and the lower subscapular, and we call it the middle subscapular nerve. But this nerve is very special. It has got another name, which is thoracodorsal nerve. So the thoracodorsal name is very famous than the middle subscapular. Most of people do not know that it is also known as the middle subscapular. They only know that it is known the thoracodorsal nerve. This nerve supplies the latissimus dorsi muscle. Remember the discussion of the back muscles of the back. So it is also known as the middle subscapular nerve, and supplies those muscles. So we have seen of the branches in between. So these were the branches, the intermediate branches that were in between different portions of the brachial plexus. And you remember, these are the terminal branches. As we have seen, we have musculocutaneous nerve, we have the axillary, lateral nerve, medial nerve, and the ulnar nerve. So the musculocutaneous nerve, as you can see from the name, is musculocutaneous. Of course, we've discussed it somewhere, but muscular, it supplies muscles and skin. So the musculocutaneous, it supplies the muscles of the anterior compartment of the arm and skin of the forearm. But also we see the axillary artery, the axillary nerve, it supplies two important muscles, and the one is the deltoid muscle, as well as the teres minor, the teres minor muscle. We have the radial nerve. The radial nerve is very important. See how big the radial nerve is. It's very important. It supplies the posterior compartment of the arm and the forearm. It gives skin sensation and a lot of features from a single nerve. We discussed about the radial nerve sometimes later. The medial nerve, it supplies muscles of the anterior compartment of the forearm. Of course, even the muscles of the hand. Same applies to the radial nerve, but the ulnar nerve also supplies the anterior compartment of the forearm and muscles of the muscles and the skin of the arm, of the hand, sorry. Okay, all right. So what is the relationship between the different parts of the brachial plexus and the clavicle? What are the relationship between different parts of the brachial plexus and clavicle? So the very first two parts of the brachial plexus, that is the roots and the trunks. The roots and the trunks, they are above the clavicle. So the roots and the trunk are above the clavicle, and so they can be found in the posterior triangle of the neck. Posterior triangle of the neck, the posterior neck triangle, they are found there. Okay, the middle part of the brachial plexus, the divisions, they are found just behind the clavicle. So they are posterior to clavicle, or behind the clavicle. And then the lower two parts, the cords and the branches, they are found infraclavicularly, so they are found just below the clavicle. That's a relationship with the clavicle. So guys, what we have discussed so far, we have the brachial plexus that has got 5 nerves that are entering, and then 5 nerves that are exiting. Okay, so the nerves that are entering, they are ventral rami. Don't forget the word ventral rami. The ventral rami C5 to T1, but the nerves that are formed, the terminal branches, musculocutaneous, medial nerve, ulnar nerve, axillary nerve, and the radial nerves. But we have seen, like, we can divide and everything in between. They are grouped in group of 3. So we have 3 trunks, 3 divisions, and 3 cords. Be careful, because some people refer the divisions as 6 divisions, because they've seen 2 from each trunk. So someone can say 6 division, it is correct, but it is also can be in group of 2. So we have 3 divisions in group of 2, so a total of 6 divisions. Okay, so we've seen each divisions. Each trunk gives rise to 2 divisions, and each cord gives rise into 2 branches. But we've seen how the medial nerve is formed, and we've seen also some other branches that are coming from the cords of the brachial plexus. So guys, I think it's important now to talk about some injuries of the brachial plexus. Remember, we have a lot of injuries in the brachial plexus, but I think at this moment it's just relevant to talk about only 2 of these injuries for you to understand. Of course, even we're not going to talk into details, because you don't know a lot of muscles of the arm and forearm, and so it doesn't make much sense to talk about everything here. So I just say something which is relevant at this point. We have a lot of them, but we discuss only 2. So the first one is Erb's palsy, or it's also known as the Erb's-Duchenne palsy. So this is actually the injury that happens to the upper trunk of the brachial plexus. Upper trunk of brachial plexus is also made up of C5 and C6, the ventral rami of C5 and C6. So damage to the upper trunk of the brachial plexus will result into Erb's palsy. Pause. So what is the mechanism? The mechanism of getting this abduction is by excessive traction on the superior trunk, or superior upper part of the brachial plexus. How happens, for example, when someone is falling onto the shoulder? So someone is falling onto the shoulder. The shoulder is forced to be away from the neck, creating this traction over here, which results into damage into this part of the brachial plexus. But during child delivery, sometimes it happens that the head of the baby is stuck. The head of the baby is delivered, but the shoulders are stuck within the pelvis, and this condition is known as the shoulder dystocia. And so there is a special maneuver for delivering this baby in this situation. But when someone is trying to pull the baby by the head, while the shoulders is stuck, will result into creating this tension like this tension over here, which will result into damage of the superior trunk of the brachial plexus. So we have the very classic presentation of the abduction palsy, which is the arm is adducted, medially rotated, with the elbow extended. We'll talk about the nerves that are involved sometimes later. It makes no sense to talk about the nerves at this point because you don't know what are the muscles that doing abduction, adduction, all that. But once we do, we know how to explain about everything that happens. So this is a classic presentation, and it is also known as the waiter tip because this is how a waiter asks for a tip, so or maybe receiving a tip for because he or she doesn't want anyone to know that he received some money from a customer, so they put this waiter tip to get the money. And so we call this Erb's palsy is also known as the waiter tip deformity, because that's how a waiter takes the money. All right, so let's talk about something very similar to Erb's fusion, which is known as the cramps paralysis, the cramps palsy, which is often confused with Erb's palsy, because they have like something alike, and so people confuse them. So this is actually almost the same to the Erb's palsy, but this happens on the inferior trunk of the brachial plexus. The Erb's palsy was happening on the superior trunk or the upper part of the brachial plexus, which was made by C5, C6, but the cramps paralysis or the cramps palsy is happening on the inferior trunk of the brachial plexus, which is made up of C8 and T1 spinal nerves. So the mechanism is also the same, traction, but this is hyperabduction traction. For example, when someone is falling from a tree and decides to catch a branch, there occurs a traction. So you are falling from a tree, and then you try to catch a branch. So there is created a tension here, which is hyperabduction tension, and this tension can damage the inferior inferior trunk of the brachial plexus, resulting to cramps paralysis. Also, during child delivery, it might happen that the baby is present with both the head and the arm, and then someone's decides to pull the arm so as to take the baby out. So sometimes it happens while they do so, the tension is created somewhere here, which results into damage of the inferior trunk of the brachial plexus, and so someone ends with cramps paralysis, the cramps palsy. All right, but it also happens that we can have tumors from the lungs. So this is a lung, and this is a lung. So sometimes you have a tumor somewhere here, which grows in separate directions, grows upward, and sometimes it compresses this inferior part of the brachial plexus, like this one. So it results into damage. It results into cramps clamps paralysis or clumsy pose. We talk about everything as we are moving. I mean, I don't know if it's wise for you to know like the mechanism on how the claw hand is brought about, because the clinical picture of clumsy paralysis is the claw hand. This is a claw hand. How we have a range of claw hands, we have different, we have the hand of benediction, but we talk about all this while we do the muscles of the hand. It will make a lot of sense there than here. Also, we know what are the nerves that are involved in, the ulnar nerve and some other nerves that are involved in clumsy paralysis. But at this moment, I think it's just wise for you to know just a little what I have displayed. And yeah, so thank you for joining me on this tour on the brachial plexus. I hope the pathways, the branches, and clinical correlation, they are now a little easier to grasp and to visualize. If you found this video helpful, so make sure to subscribe and hit stay tuned for more anatomy and anatomy contents, sessions to come. And until next time, keep learning, keep exploring.